Hello everyone, I'm Kamfetsui and today I'm going to show how to dissect a kidney. So as you can see here, I have a kidney and it's a cow kidney. So I'm going to use a cow kidney to show how to dissect a kidney. So as you can see here, our cow kidney is made up or divided into 15 or 20 irregularly shaped or sized lobes. So as you can see here, we have the lobes. And also these lobes are separated by the fissures of different depths that are filled with fat. And our kidney also, it is covered by the renal capsule, which is a tough, smooth, semi-transparent outermost layer which covers the outer surface of the kidney. And also this capsule is also covered by the fat layer, but here as you can see, our kidney does not have a fat layer, so there is no need to remove that fat layer. Also here, if you can see inside here, we have this white material or white tissue which we call the renal pelvis. This is where the renal artery, the renal vein and the uterus connect to. So here we have a hole where the uterus or the renal artery and the renal vein connect to, and the renal artery is the one that transports the oxygenated blood to the kidney or inside the kidney, and then the renal vein is the one that takes back the blood to the heart. So the uterus also is the one where the urine passes through from the kidney to the bladder. So here I'm going to show how to dissect a kidney. We are going to dissect or cut the kidney longitudinally into two halves. So here I'm going to use this scalpel blade to cut our kidney into two halves. So let's cut our kidney. Cut our kidney into two halves. And as we cut through, we are going to see the two most layers, the outermost layer, which is the cortex, and the inner layer, which is below the cortex, called the medulla. So we finished cutting our kidney longitudinally. As you can see here, we have two halves of the kidney, and here as you can see, we have the outermost layer, which is the cortex, and it is lighter in color. As you can see here, it is lighter in color, and then we have the medulla, which is darker in color. So here, as you can see, the medulla is triangle shaped, which the shape is in triangle. We call that a pyramid, yeah? And then also, as we can see here, if we can cut open our medulla. Remember, this is the cortex, which is the outermost layer, and it is lighter in color, and then we have the medulla, which is darker in color. And then if we cut here, we can see the white tissues or the white things here, which you call the calyces. This calyces is the ones where if the urine is filtered, the waste will come from the calyces to the pelvis. The pelvis is this white material or the white tissue here, the renal pelvis. The waste will come from the calyces of the medulla or the pyramid, where they will fill up this pelvis, and then when this pelvis is filled, the urine will leave the kidney and will pass through the uterus into the bladder. So as I mentioned earlier, the cow's kidney, they have 15 to 20 size shaped, irregularly shaped lobes. So each lobe of this kidney, they contain what we call the pyramid. As you can see here, this lobe here, this lobe here, this lobe here, they all have the pyramid. The pyramid is the triangular shape of the medulla. And also, as I explained, that also there are millions of nerve fibers called the nephrons. The nephrons, they can be found here in the cortex. They come from here, from the cortex up to the medulla and to the renal pelvis. What happens is that the nephrons will filter the blood, and after they have filtered the blood, those waste from the blood will come from the cortex through the cartilages of the medulla and then passes through to the renal pelvis. When the renal pelvis is filled up with the waste, they will go to the uterus, and the uterus will then remove those waste from the kidney into the bladder, where it will pass as a form of urine. So today we learned how to dissect the kidney. As we can see here, we have our two kidneys. We have the cortex, outermost layer, the medulla, which is below the cortex. We also have the renal pelvis. We also talked about the hole, which we find here, this hole where the uterus, the hole here, which is the uterus, where the uterus connects to, the uterus connects to. This uterus, the one that helps, that pass there to allows the urine to pass through from the kidney to the bladder. Also here we have our disinfectants here, which we use to clean our surfaces. So after here, we're going to remove this and clean our surfaces. We also have the paper towel to wipe our surfaces. Also, we use the scissors and also the scalpel blade to cut our kidneys. Thank you very much for your time.